Have you ever wondered about the ins and outs of medications that treat autoimmune conditions? Meet Stelara, a powerful biologic drug that's making waves in the medical community. Whether you're newly diagnosed or exploring treatment options for conditions like plaque psoriasis, psoriatic arthritis, Crohn's disease, or ulcerative colitis, this video will uncover the top 10 facts about Stelara to help you understand what it is, how it works, and what to expect. Number 1. What is Stelara? Stelara is not your typical medication. It's a biologic drug, which means it's made from living organisms, such as plant or animal cells in a laboratory setting. Specifically, Stelara is a monoclonal antibody, a type of protein created to target specific substances in the body. It's like having a tiny, specialized soldier that knows exactly where to go and what to attack to help manage your condition. Approved by the FDA, Stelara is used to treat a variety of autoimmune conditions, including plaque psoriasis, psoriatic arthritis, Crohn's disease, and ulcerative colitis. Since its approval, Stelara has become a trusted option for many patients seeking relief from these chronic and often debilitating conditions. Number 2. How does Stelara work? Understanding how Stelara works can give you more confidence in its role in your treatment plan. Stelara targets two specific proteins in your body, interleukin-12 or IL-12 and interleukin-23 or IL-23. These proteins play a key role in the inflammatory process that characterizes many autoimmune conditions. By binding to these proteins, Stelara helps to reduce inflammation and the subsequent symptoms. This targeted approach is what makes Stelara so effective. By focusing on IL-12 and IL-23, it helps to calm the overactive immune response that lead to conditions like psoriasis and Crohn's disease. This means fewer flare-ups and a better quality of life for many patients. Number 3. Administration methods. Stelara is available in two forms of administration: subcutaneous injection and intravenous or IV infusion. The subcutaneous injection is a shot given just under the skin, typically in the thigh, abdomen, or upper arm. Your first dose might be administered by a healthcare professional who will also show you how to self-inject future doses at home. For conditions like Crohn's disease or ulcerative colitis, the initial dose of Stelara is given as an IV infusion. This is an injection directly into your vein, usually over the course of an hour in a healthcare setting. After this initial dose, subsequent doses are given as subcutaneous injections. This flexibility in administration makes it convenient for various treatment regimens. Number 4. Conditions treated by Stelara. Stelara is a versatile medication that treats several autoimmune conditions. It's primarily used for plaque psoriasis, helping to clear the skin for those frustrating and often painful patches. If you have psoriatic arthritis, Stelara can reduce joint pain and swelling, making daily activities less of a struggle. In addition to skin and joint conditions, Stelara is effective for gastrointestinal issues. For those with Crohn's disease and ulcerative colitis, Stelara can significantly reduce inflammation in the intestines, leading to fewer symptoms and better overall digestive health. It's like having a multi-tool in your medicine cabinet designed to tackle different aspects of autoimmune disorders. Number 5. Dosage information. The dosage of Stelara your doctor prescribes is tailored to your specific needs. Factors like the condition being treated, your age, and your weight all play a role in determining the right dose for you. For example, patients with plaque psoriasis might start with a different dose compared to those with Crohn's disease. It's essential to follow your doctor's instruction when taking Stelara. They will determine the best schedule for you, which might involve an initial higher dose followed by maintenance doses every few weeks. Adhering to this schedule helps ensure the medication works effectively and keeps your symptoms under control. We made a buck! 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to check it out. Number 6. Side effects of Stelara. Like any medication, Stelara can cause side effects. Some of the more common ones include headaches, upper respiratory infections like the common cold, and fatigue. You might also experience redness or changes in skin color at the injection site, or develop mild allergic reactions. However, there are also more serious side effects to be aware of. These can include severe infections, a heightened risk of certain cancers, and serious allergic reactions. It's crucial to monitor your health and report any unusual symptoms to your doctor immediately. They can provide guidance in managing side effects and ensuring your treatment remains safe and effective. Number 7. Drug interactions. Before starting Stelara, it's important to discuss all your current medications with your doctor. Stelara can interact with other drugs, potentially altering its effectiveness or increasing the risk of side effects. This includes prescription medications, over-the-counter drugs, vitamins, and herbal supplements. One critical interaction to note is with live vaccines. Because Stelara suppresses the immune system, receiving a live vaccine while on this medication can increase your risk of infection. Vaccines like MMR or measles, mumps, rubella, chickenpox, and yellow fever should be avoided. Always consult your healthcare provider about your vaccination schedule when taking Stelara. Number 8. How long does Stelara take to work? Patience is key when taking Stelara. While the medication begins working in your body shortly after the first dose, it can take several weeks before you notice significant improvements in your symptoms. This can be a bit frustrating, but it's important to give the medication time to build up in your system. Typically, patients start to see results within a few weeks to a few months, depending on the condition being treated. For instance, those with plaque psoriasis might notice skin improvements sooner than those with Crohn's disease, who might experience more gradual relief of intestinal symptoms. Regular follow-ups with your doctor can help track your progress and adjust treatment as needed. Number 9. Alternatives to Stelara. If Stelara isn't the right fit for you, don't worry. There are plenty of alternatives. Other medications for plaque psoriasis include topical treatments like vitamin D oils, methotrexate, and biologics such as etanercept or Enbrel and adalimumab or Humira. Each of these has its own set of benefits and potential side effects, so it's important to discuss these options with your healthcare provider. For psoriatic arthritis, alternatives include drugs like apremilast or Otezla and secukinumab or Cosentyx. If you're dealing with Crohn's disease or ulcerative colitis, medications like infliximab or Remicade and vedolizumab or Entyvio might be recommended. Your doctor can help you weigh the pros and cons of each option to find the best treatment for your needs. Number 10. Patient experiences and testimonials. Hearing from others who have walked the same path can be incredibly reassuring. Many patients report significant improvements in their quality of life after starting Stelara. From clearer skin and reduced joint pain to better digestive health, the benefits can be life-changing. One patient, Jane, shared her story of battling severe plaque psoriasis for years before trying Stelara. Within a few months, my skin was clearer than it had been in decades. I finally felt comfortable in my own skin, she said. Another patient, Mark, found relief from Crohn's disease symptoms, allowing him to enjoy a more active lifestyle. These testimonials highlight the potential positive impact Stelara can have. If you're considering Stelara or are already using it, discussing your options and any concerns with your healthcare provider is crucial. Remember, each person's experience with medication can vary, and finding the right treatment is a journey. Share your thoughts or questions in the comments below. And let's continue this conversation about managing autoimmune conditions with confidence and support. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life.